There, I'm here.
Hello.
It's been a good Friday morning, let me tell you.
Dang, have you looked at the forecast for tomorrow?
Is that where it's supposed to be super cold?
36.
Yeah, yeah. I'm just glad my family's power is all back on. So our last one came on, my mom's came on this morning, and so I don't have a house full of people today like I did yesterday because that was I guess I'm used to working in a quiet house, and so it was quite disruptive yesterday to have everybody here. So
Yeah.
and even last night, just our normal schedule at home and stuff was different having a house full of new people. So
Yeah. That's why I was glad the boys went back to Kansas City last night or yesterday morning. It's like, oh, my house can breathe again.
I want to welcome everyone who's on the call so far. As normal, we ask that if you could please type in chat your organization, your role, if you would like to share that with us as well, so that we know who is on the call today and what roles are on the call today. It's 10:57, so we have about 3 more minutes and then we will get started.
I would also like to add, if you are not the only person in the room watching, would you please put in the chat how many are in the room watching with you so that we can let KDHE have a good understanding of how many we're reaching.
And again, while we're waiting, I see lots of familiar names, and we just cannot thank you enough for coming back and joining us each and every week. So thank you, thank you. Okay, we are just at 11 a.m. So again, my name is Brenda Groves. I welcome you to our KFNC and KDHE HAI Project Firstline Topic 12, so Session 12. Today we will be covering the environmental cleaning and disinfection. Again, thank you for joining us. And if you have not already, please type in your name, organization, and how many people are with you into chat. And at this time, I will pass to Miss Nadine.
Welcome, everyone. Ooh, it's echoing at me. I would like to second Brenda's welcome to you all. And we took a little bit of leader license here and switched up the topic for today. If you were paying attention at all to the registration flyer, you registered for hand hygiene, but today we decided we would go ahead and cover environmental cleaning and disinfection because of the amount of questions that we've had over the course of the last 7 weeks. This is our 8th week to be together on Friday. And so we're going to touch a little bit today on environmental cleaning and disinfection. So welcome to today's topic. Today, what we're going to, or what we expect to learn today, is that you will be able, by the end of the training today, you will be able to describe the difference between cleaning and disinfection and discuss why it is important to follow the label instructions on a disinfectant product. And we did have some of that conversation early on. So today's training will reinforce that. We clean and we disinfect a lot in healthcare, but what's the difference? And because we don't have a polling feature, if you guys could type into chat what your thoughts are, pick the sentence that best describes cleaning and disinfection for you. Is it cleaning is killing germs? Disinfecting is removing dirt and some germs. Disinfection is, or disinfecting is a type of cleaning, cleaning with chemicals. Cleaning is a type of disinfecting, disinfecting with soap or detergent. Or disinfecting is killing germs, cleaning is removing dirt and some germs. If you could put that answer in chat, that would be great. And if you want to make it easy and say A, B, C, D, or 1, 2, 3, 4, Give you a few more seconds to put your answer in chat.
We have two responses and both are D.
Okay. You're right. So let's go ahead and watch the, once I get it up here, unfortunately, I have to do this weirdly. Let's go ahead and watch the first video that we have today. And let's hear what Dr. Carlson has to say about cleaning and disinfecting and what's the difference.
Welcome back, everyone, to Inside Infection Control, our video blog here from CDC's Project Firstline. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's great to have you here today. Today, we're going to talk about cleaning and disinfection. And we hear that phrase a lot, cleaning and disinfection. They're talked about together, but there is a difference between them. What is that difference? Cleaning is the process of removing dirt, germs, and other gunk that you get on surfaces and objects. Disinfection is a different step, usually a separate step, but not always, that kills germs on surfaces or objects. Cleaning and disinfection are both very important, and they keep infections from spreading in healthcare. But how? Let's break this down a little bit. We'll start with cleaning. You can think of cleaning as removing the gunk that you can see on surfaces. It also removes some things that you don't see, like germs. When you clean your house, you're getting rid of dust, dirt, grime, and all the other spills, smears, and stuff that happen in everyday lives. But in healthcare, we do exactly the same thing. Just like your house, dust and dirt contains skin cells, dust mites, hair, debris. It's even more important in healthcare, though, because those things can get not just into the environment, but onto patients, onto wounds, onto burns, into your mouth. And we need to keep those away from our patients. And spills and smears in healthcare can include things like body fluids, blood, urine, and sweat. And we need all of that to be cleaned up. It's common sense that cleaning is important in healthcare, and sometimes cleaning is enough, but sometimes disinfection is necessary. Cleaning doesn't kill germs, it removes them. Disinfection kills germs. Disinfection shouldn't come before cleaning. They either happen at the same time in a single product, or cleaning comes first in the two-step process of cleaning and disinfection. Why is that? When you do disinfect, it's important that the surface is clean, because if it isn't, the disinfection might not work. The product might not be able to get to the germs because they're covered in other things. If there's dirt or spills or smears on the surface, the other thing is that you might spread that around while you're disinfecting, because the disinfectant won't necessarily pick that up and clean. So killing germs is important in healthcare because bacteria that is there that can get into our patients who are ill and weak. And the same goes for viruses and other infectious germs. And when our patients are ill and weak, they're more likely to get really sick from certain germs that we find in healthcare. So you can see why cleaning and disinfection are both so important. We've posted a link to more information in the Facebook comments below, including a list of disinfectants that are effective against SARS-CoV-2, which is the virus that causes COVID-19. So be sure to check us out on Facebook, as well as on Twitter and YouTube, where our videos are getting.
Okay, so let's go back to our PowerPoint. As Dr. Carlson said, cleaning is a process that removes things like dirt, dust, grime, other spills, just everyday stuff, along with some germs. And disinfection is actually the process that kills those germs. I think based on some of the responses we had in chat, that people did already understand the difference between cleaning and disinfection? Or is there anything about these definitions that was new to you? So I am going to take the opportunity. We've had some questions in the past about contact time, and we have another video that we can share that Dr. Carlson addresses the topic of contact time and why is it important. So we're going to go ahead and play that at this point.
Welcome back, everyone, to our video blog here at CDC's Project Firstline, Inside Infection Control. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's great to have you back with us today. We have talked in earlier episodes about cleaning and disinfection, what each of those do and why they're so important in healthcare. You'll remember that cleaning removes dirt and gunk and some germs that are on surfaces, and disinfection comes after cleaning and kills those germs. Today, we're going to focus on disinfection and specifically about something called contact time, what it is and why it's so important. Contact time, and you're also going to hear this called dwell time or wet time. It's the amount of time that a disinfectant needs to sit on a surface before being wiped away or otherwise disturbed in order for it to do its job. And its job, as we know, is to kill the germs. There are a lot of germs in healthcare. That's no surprise to any of us. And quite obviously, we don't want them to spread around to our patients or to others. When we disinfect surfaces like bed rails and door handles, or when we disinfect equipment like stethoscopes and other devices, all of that is a huge part of infection control. And that's why it's important to disinfect correctly. Now, in the United States, we rely on the Environmental Protection Agency, the EPA, to review the chemicals that are used in the workplace to make sure that they're safe. Disinfectants used in healthcare should be registered with the EPA, and the label usually says something like hospital grade, which identifies that product as being what that can be used in the healthcare setting. We've put a link below to one of the EPA's specific lists, List N for November, which is the list of disinfectants that are effective against SARS-CoV-2, our virus that causes COVID-19. Now, when you're using a disinfectant, it's incredibly important to follow the instructions on the label. And there are a lot of reasons to do that. You have to know what the chemical can be used on, which surfaces it can be used on before you use it. You have to know which germs it's been proven to kill so that you're using it in the right place at the right time. And you need to know if it needs to be diluted, which means adding water to it to take the concentration down to a safe concentration and a correct concentration for killing germs. It's a little bit like cooking, and you want to use the right ingredients and follow the recipe. But one of the most important reasons for following the label instructions is to know the contact time. The product that you're using might not kill germs right away. It actually takes time for germs to react with the chemical in the product and get that killing effect on the germs before we can say that something is truly disinfected. Depending on the product, the germ that you're targeting, this time can vary, but it's always specific and it should be on that label. If you're using a product that both cleans and disinfects, it's still going to have a contact time that you need to know. It's also important when you're doing this not to rush things. Don't wipe the surface with another cloth before it's dry, hoping to dry it off more quickly. Definitely don't blow on it with your breath or try to dry it off with your breath, because you have germs in your breath, unfortunately, that will make it dirty again. And don't blow air on it in another way, like with a fan, unless the maker of the product says it's okay to do that. Sometimes you might be in a really dry environment, and actually the product might dry too fast before the contact time has finished. There should be instructions on what to do if that happens that the manufacturer gives you. But in general, most of the time you have to reapply the product. You have to just put it down again on the surface and add another layer to meet that full contact time to get the killing effect. You have to wait for the entire contact time to finish before anything can be used again, whatever it's used for, or before a new patient comes into a room after a last patient was discharged. We know that this can be really tough. We're trying to get people in and out of our rooms and out of place as soon as possible. And we know that patients are waiting for rooms and waiting for equipment, and there could be a lot of pressure because of all of that to move fast. But the risk of spreading germs when you push room turnover or equipment turnover is just too big. That's why it's so important to make sure your disinfection is complete before you move on to the next patient. If you're the person doing the disinfection, you want to do it correctly to keep patients safe. If you're a supervisor or another leader, your plans for room turnover or equipment turnover should take into account the time that these products need to work. And it's important not to rush people to use the product incorrectly just to meet a deadline or a timeline. You have to set the process up to succeed and to allow your staff to use the products correctly. If turnover time is a concern, rather than using a product incorrectly, choose another one that works best for the timeline that you need. So, to sum it all up, when you're aware of contact time, you can be sure that you're killing the germs the way you're supposed to and keeping them from spreading to other patients and other colleagues and other people in your environment. All right. Thanks everybody for joining us again. As always, please follow up with us on Facebook, on Twitter, on YouTube, and on the web, CBC.
Okay. So, as we listen to that in the previous video, does anyone have any, we'll just take a minute or two here to give you the opportunity to express any final thoughts or any questions or any areas of confusion, anything that you would like to clarify or ask about or just comment on in general. Please use the chat feature. And I did notice that we've had some additional people join us. So if you joined later, you missed our instruction. If you've got other people in the room with us, would you please tell us when you tell us where you're from, how many people you have in the room with you? Any comments or thoughts or questions? I think she did a really good job about explaining what contact time was and you know, can anybody think of any instances in which they did exactly what she said not to do? Like blow on something or wave something over a surface or get it wet, wipe it down. Brenda was sharing with me this morning that some of the survey results that she's looked at for some of the long-term care facilities, that's one of the things that the surveyors are observing is people taking a disinfectant and wiping a surface and then immediately following it with something dry to dry it, which completely just invalidates and renders useless what you just did. So I had to think about this as the visual picture that came to my mind when they were talking about blowing on it. Anybody old enough to remember in school when they put mercurochrome on an owie in school, the orange stuff that burned like a booger, and they blow on it because blowing on it made it hurt less. Sorry, that was the random brain thought that came into my mind when she talked about that. We have some comments, I think.
Yeah, we do have one comment. It states not keeping it wet long enough. We changed the ER to a 2-minute wet time to speed turnaround time.
Mm-hmm. Yeah, some of the products that we've used historically have to be wet for 10 minutes. Let's be real here. How many people have environmental services folks that are going to stand there and continue to wipe something for 10 minutes to keep it wet, because it's not just wiping it and letting it sit because it doesn't stay wet that long. That's actually a good in-servicing kind of thing that some of you who do those things could do with your staff. And look at your products. Evaluate your product based on how long in real time it needs to stay wet. So we've talked about ways that cleaning and disinfection are part of our daily work life and how they work. And remember that cleaning is an important step, because if we try to disinfect something that isn't clean, the disinfectant might not work. And we need disinfectants to kill germs. So let's take a few minutes to talk about why this is so important in healthcare. Thoughts on in healthcare, why is that so important that we clean and disinfect properly? You guys are quiet today.
It has been a very strange Friday, so it's been a very strange week.
Yeah. Weather beside. Well, in healthcare, we have patients who are ill or weak, and they can be very compromised by not cleaning and disinfecting properly.
We did just have a comment come through, and I like this comment. It's everyone's health is at stake. So, each and every one of us. And then she stated our EVS is one of the most effective ways to keep us all healthy.
Absolutely. And I think EVS has historically been the least recognized infection prevention and control tool that we have. If we don't have good EVS staff to keep the environment clean, we're in a world of hurt. And it's common sense that we don't want a dirty environment for our patients or our residents or our clients. So it is important that we make sure that we protect those people with weakened immune systems. And some of our own team have weakened immune systems, and we don't know that maybe. So we do need to take care of that. Why does that matter? Germs are more likely to cause problems in these patients because their immune defenses may not be the same as someone who's healthy and living at home. We've certainly learned that through this ordeal of the last 2 years with COVID. It's important to keep the healthcare environment clean to stop from spreading germs. And there's a lot in healthcare. So when we think about a patient room and a patient leaves the room or is discharged before a new patient goes into that room, it should be cleaned and disinfected to make sure that germs don't spread. What about high touch surfaces? We also clean and disinfect things that get touched a lot, such as bed rails, keyboards, light switches. Those are high touch surfaces that need to be frequently cleaned and disinfected. And what else? It's also important that surfaces and objects that often have a lot of germs on them get cleaned, like toilet seats. And especially in an environment where they're shared. So we watched the video about contact time. So let's talk a little bit more about it. Sometimes it is called dwell time. It's the amount of time that a disinfectant needs to sit on the surface without being wiped away or disturbed to effectively kill the germs. And so let's talk a little bit about disinfectant labels. While you can usually judge if something is clean or not just by looking at it, this doesn't work for disinfection because germs are too small for us to see. We can't judge how well something has been disinfected just by looking at it. So that's why following the instructions when you use a disinfecting product is so important. So what information do you need from the label to make sure that you're using it correctly? You can put that in the chat. Dr. Carlson talked about this. No thoughts from anybody? How about, is the product EPA approved? Dr. Carlson talked about the EPA being that agency in the United States that all products have to be registered through. They are charged with reviewing chemicals used for disinfection to make sure that they're safe and effective. And disinfectants used in healthcare facilities will usually have hospital grade or something similar on the label.
We do have 2 comments. One was how long it needs to remain wet on service. So contact time will be on that label. So good job with that. And as well as what it kills and what requirements are needed to give it time to be effective.
Okay.
Good answers.
Good answers. Another one that I would like to point out is, on which surfaces can the disinfectant be used? You know, that's been one of the big dilemmas with cleaning rooms that have had a multi-drug resistant organism like C. diff or MRSA in them. You know, not everything will tolerate the cleaning products that are used on them, like computer screens. Can you use some of the disinfectants on a computer screen? And we'll repeatedly refer people back to look to the product manufacturing guidance to see that, for the equipment, to see what kind of product can be used on it to clean and disinfect it. So those things are important. The other thing that you need to look for is what germs the chemical has been proven to kill. That's important. And whether the product should be diluted. That means if it needs to have water or another substance added to it to bring the concentration down so it's safe to use. A lot of those products are highly concentrated, and we do have to dilute them. The other thing, if so, the label should tell you how to do that and what to use. And of course, the label will tell you the contact time or dwell time or wet time. We've already talked about, should the product be diluted? So what are some do's and don'ts? We know that we want to use disinfecting products at the right time and correctly, but what do we not want to do? One of the biggest do's and don'ts is don't rush the process. The entire contact time has to finish before something that's been disinfected can be used again, like shared equipment, or before a new patient comes into a room after the last patient has been discharged. That's how we can be sure that the disinfectant has had time to do its job and kill the germs. And don't try to dry a surface that's been disinfected more quickly by wiping another cloth or by blowing on it with your breath. Also, don't blow air on the surface in any other way, like a fan, unless the manufacturer has said it's okay to do that. And be patient. You really have to be patient. We know this is tough. Patients may be waiting for rooms and equipment, and there might be pressure to move fast, but the risk of spreading germs is too great to rush the process. Following the instructions keeps germs from spreading and keeps your patients and coworkers safe. And I know from, well, I'll cover that here in a minute. The other thing that is a good place to go for you to determine whether or not a product is going to be effective for what you want to use it on or use it for is to go to the EPA's List N. It is a searchable database. You can find products that will kill SARS-CoV-2 as well as what'll kill VRE, what'll kill C. diff. So look to that list. So when we think about today and what we've talked about, this is the last of our time today. We've got about 3 minutes. So I'd really like to hear from you what you learned today, what anyone would like to share. Are there any? The other thing I would like to add here is I know that I have observed different things being used in facilities than what we maybe traditionally used. Like I've seen a fair number of facilities using hydrogen peroxide spray, and they're going into the rooms. They've got their, actually I've seen the plant ops people doing it. They go in after a room has been terminally cleaned by the EVS staff. They go in and they have a fogger that they'll go in and they'll fog a room. So what are some things that what have you learned? What are some new things that you guys are using to help make sure your facilities stay clean and disinfected? And what have you learned throughout the last, honestly, it can cover the last 8 weeks. The other thing I'll add to the comment request is, since we have spent 8 weeks together and we've talked about a lot of different things over that 8 weeks, what are some things that are still hanging out there as far as questions or topics that you would like to see us address? We're actually giving some consideration to doing in our monthly open office hours calls. We're thinking about adding some topics to those calls where we can cover something that you guys have burning questions about or you want more knowledge on. Think about those. What kinds of things would you like to see us do there? Do you think that's a good idea? Would you like to see more Project Firstline education? This is your wish list opportunity. And lastly, have you found the last 8 weeks helpful? Has it been, I know that we've seen some of the same people week after week. So there's something of value that you're coming back to the table for every week. I also would like to know if there's anyone that wants some kind of certificate of completion, particularly if you have been on each call every week, or you need to have some kind of attestation back to your employer for what you've attended. And it's almost Christmas, guys. You get next week off. Have we had anything, Brenda? I see we're at time, so.
Yeah, we had one comment that the series reiterated what was already known, but it was full of great reminders.
Great. I do have one question. Brenda and I have been having a conversation about many of you are covered under a new regulation through KDADS, or I'm not sure, guideline, whatever it is, that you can utilize family caregivers in your settings, but that they need to be trained. So do you feel like this Project Firstline, some of the episodes of Project Firstline would be a valuable tool for you all in educating those caregivers that need to be in your buildings so that they understand infection prevention and what they need to do for basic infection prevention guidance? I did see one request for a certificate. Make sure you have your email address in the chat box as well, so we can get that to you.
Yeah, we have his.
Okay.
Yep.
I just saw a comment about caregivers. It went quick.
But this would be great for caregivers, even if they know, it's still a great reminder of what we need to do to keep ourselves and our loved ones healthy.
Okay. Well, I personally want to thank you all for hanging with us every Friday at 11. Hopefully you have seen value in this series, and if you've got people that you know need to do this and you'd like to see more of it, just shoot us an email that says, hey, can you continue this, or direct us to where we get the resources, and we'll shoot out an email to those of you who have provided email addresses to us on where you locate the trainings and the videos. And you certainly, anybody can do this. You could always use us as resource questions. Let us know what we can do for you moving forward. And we look forward to talking to some of you next month at the first combined nursing home and communal living office hours call. Merry Christmas. Happy holidays, everyone.
I'll hold chat down real quick so we make sure we get those emails. Okay, I'm going to close this out.
Great.
Thank you, everyone.